Hospitals in India will soon get much-needed aid after the likes of the United States and the United Kingdom confirmed they'll send items including ventilators and oxygen concentrators to a country that's currently being ravaged by COVID-19. The US will also send raw materials used to produce the AstraZeneca vaccine. India has again recorded a record number of infections, with over 352,000 people testing positive for the coronavirus on Monday alone. Doctors in the country have also taken to social media to plead for oxygen and other supplies to treat overwhelming numbers of patients. Ritesh Maliks is part of the Radix Healthcare Group and a doctor in New Delhi, joining us now to talk more about the COVID-19 crisis in the country. Doctor, thank you so much for your time and patience today. How severe are the COVID-19 cases that you've been seeing?
This has become a big menace for cities like Delhi, Bombay, Bangalore, which are the major cities of the Indian subcontinent. We are seeing a massive spike from the first COVID wave, which just saw 98,000 cases at its peak on September 16, 2020. And as we speak today, we are at 0.35 million cases a day. That translates to 3.5 lakh cases. And this is when testing is not happening on ground. So we are seeing a massive challenge in front of us. And the sad part is we have not peaked out yet. We are assuming that as a country, we will peak around May 5th or 6th. And we are seeing a lot of fatalities and a lot of unwarranted loss of life in India.
And we talk a lot over the past few weeks about the need for oxygen supply, but it's one thing to have an oxygen cylinder. One of the things you've been explaining online is just how much oxygen a single patient needs per minute even.
So COVID is a pulmonary disease and severe cases. And in fact, the intensity of COVID for COVID's second wave is at least 4 to 5 times more than the intensity that we saw in COVID-1. The virus, which was COVID-19, and the virus, which is COVID-21, are two different viruses with extremely different results. We are seeing patients are losing their oxygenation too fast and too quick. Patients are losing oxygenation, and we are also seeing the fact that at almost 65% of the new cases that we are seeing are under the age of 45. And when it comes to oxygen, as a hospital, cylindrical oxygen, which is the 27D cylinders, hardly give you any oxygen. One cylinder of 27D can run our hospital, which has close to 60 patients, for not more than 15 to 20 minutes. And we need at least 28 to 30 cylinders to just keep us going for 9 to 10 hours. What we need is liquid oxygen. Liquid oxygen is compressed form of oxygen, which can be stored at our hospital in our oxygen tankers. And they give us a respite of at least 24 to 36 hours, and that is a massive shortage in the national capital of India.
And you work as a doctor along with your father and your sister. You are in private healthcare in India. Is there any significant difference in the quality of healthcare for people in the public and private healthcare sector currently? Because we're seeing these images of people dying on pavements outside hospitals.
So currently, I don't think there's a difference. Currently, the big challenge is if you are in Delhi, however affluent you are, it's very difficult to get a bed. It's very difficult to get basic medicines. It's very difficult to get oxygen, even for your home. Today, if you ask that I want an oxygen concentrator for your home, which is a 5-liter machine, which can take atmospheric oxygen from 21% and increase that to 93%, it's completely out of stock. We are lacking basic medicines of steroids. We've been swept by this wave, and we are seeing a massive upsurge and a massive uptick in the number of cases this time, and it's extremely severe. We do not have ICU beds. In total, we need 730 metric tons of oxygen, and we are just being supplied with close to 350 metric tons. So we are in massive paucity, and our healthcare infrastructure is not capable to solve a challenge this large. And the only long-term way for us to have COVID past us is to vaccinate. And I was seeing a very interesting thing at the eNCA, which was vaccination in developing nations like Asia and Africa, especially Africa, where only 2% of the population has been vaccinated. The only long-term solution is vaccination. the patients who have been vaccinated at our hospital are seeing milder, lesser number of symptoms than the patients that have not been vaccinated.